So during the Obamacare debates, Democrats had to let go of this idea of the public option, which was the federal government's alternative healthcare system that would exist next to the private healthcare industry. But now it seems that heterodox conservative intellectuals are bringing up the idea of a private option. What exactly is the private option?
Well, we call it the personal option, and you're right. It's very different from a public option, which is really the first step towards a complete government takeover of healthcare. A personal option starts with the premise that healthcare is personal. We should have choices. It shouldn't be the government or insurance companies making our decisions. We should make them. So the philosophy is, let's do two important things. First, let's remove barriers between patients and care. And second, let's empower patients to shop for value as true consumers of care. The problem in American healthcare is the patient is not really the customer. The patient is the product. The real drivers of our system are these big insurance companies, hospital corporations, pharmaceutical companies, and so on. Let's change that so the patient and the doctor are in the driver's seat. It really comes down to one thing: trust. Who do you trust with your health care? The government or your own doctor? And in our polls, even supporters of a government takeover of health care tell us they trust their doctor more.
So one of those mechanisms to make it so the patient is the consumer are HSAs, or health savings accounts. By some estimates, they're almost $100 billion of American money in HSAs right now. But who are they accessible to? What exactly are they? And how can they be expanded or modified in some way to help benefit more people?
A tax-free health savings account is a wonderful tool that gives you, the patient, more control over your health care, and it comes with generous financial benefits. The money's tax-free. It basically means you can buy more health care that you need with the same amount of money. It's like getting a discount on every medical purchase you make. If you're a family that needs insulin supplies, blood glucose monitors, and so on, your money goes a lot farther because you're getting something like a 10 to 40% discount on every purchase from the account. An HSA is a tool to empower patients to take charge of their health care. But you mentioned how many people can have it. Right now, current law, because of federal rules and red tape, only about 1 in 10 Americans can have a health savings account.
Wow.
We want to change that. Why not HSAs for all? Shouldn't everyone have the ability to pay and save for their own health care tax-free?
And so it's tethered to your predominantly employer-sponsored health care, right? Whether or not you have access to one?
Well, most HSAs are in the employment-based world. Employers are putting money in their workers' accounts, those who offer HSAs. Most do not offer an HSA. And you can have one even if outside the workplace. The problem is the government requires you to have a certain kind of health insurance, which almost all Americans lack access to, including most working Americans.